Ladies and gentlemen, Daniel Tarlow, craniosacral therapist. So, first of all, I'm sitting, you can't see me from the video, but you're holding this strange looking thing. Hold it up higher. Whoa, what is that, dude?
Well, this is a skull. This shows you, although in reality your bones don't look like this, I mean, they're these shapes, they're not these colours. This is just to show you the different bones that exist in our skull and how they fit together. What's really interesting, and one of the ways that craniosacral therapy was discovered was to notice the difference in the types of connections of the bones. These are called sutures, and there are basically, for these purposes, we'll say there are four basic large bones in the skull. There are lots more, but you have the frontal bone, you have the parietals, which form the crown of your head, and the occiput at the back, and then the temporals, which make your ear bones. And each of these, what's fascinating, is that each of them have a different connection one to the other. And the basis of craniosacral therapy is that due to the differences in the way these bones connect, you're able to release tensions in them in specific directions, and that helped to alleviate issues with the nervous system and improve the function of the nervous system. So, for example, what's really interesting is the way you have the zigzag shape of the bones here. Now, what that means is that as these teeth connect, the bones of the parietals are able to move inward and outward laterally, but there's no real give for them to move forward and backwards. So sometimes we find that there can be issues that a person has. Maybe they can have migraine issues, sleeping issues, other issues could originate from this area, and there'll be a specific technique which helps with this bone. Whereas the frontal bone has these sort of teeth more in the forward-backwards direction, and so there are different techniques for helping to release the tensions that might build up for whatever reasons in the frontal bone. And again, what's fascinating when it comes to the ear is the way the temporal bone actually has this circular motion and movement.
What do you mean by motion?
Well, the ability for the bone to move, the direction that it can move in, as opposed to these bones where the movement that could take place is inwards and outwards.
Are you saying that our bones actually move?
Well, it's a slightly controversial issue, but there is a lot of medical data, and this has been done by NASA, by the Russian Space Organization as well, amongst other people and organizations that have shown that there is movement, not a lot, but there is slight movement in the bones, between the bones, even in adults. And that's one of the basis of craniosacral therapy, is that because of this ability to have motion, we can also, when that ability goes away, when there's when for whatever reason there are restrictions and tightnesses in these, they're basically joints really, aren't they? They're like a joint. Just a joint here that we normally think of in our arm has much more motion. This is really a joint.
Is it easy to feel this motion?
Well, it's not hard, but you have to learn and train yourself, and you have to have develop a high level of sensitivity in your hands. But again, your hands are one of the most sensitive parts of your body, like your toes, your fingers are highly sensitive, and when you feel that, when you develop that sensitivity, then it's for some people it's very natural to feel that movement. And so we also have movement here, and again, going back to the directions here, the direction will be slightly different because of the way this joint is made. In fact, just like if you think about the joints that we have even in our arms, our fingers, that our fingers are able to do, different joints have different motion, different ability. It's very hard for my finger to move left and right. It's much easier for it to move up and down. So craniosacral therapy really helps to alleviate from the bones the nerves, and the whole nervous system allows to release tensions and tightnesses, and it helps to improve the function of the nervous system and deal excellently with pain conditions in particular.
And what would you say this particular man's problem is? Can you tell what's going on with him just by feeling his bones like that?
I'd say that one of the problems he has is lack of protein in his diet. I think his skin complexion really isn't good, and his hair, I think he needs to get a better shampoo really, and a moisturiser I think would really help. You think a moisturiser would be good for him? That's what I would. I'm not sure that. I mean, in all honesty, there's a lot of great things that craniosacral therapy does, but he may just be a little beyond even the magic hands of a craniosacral therapist. Also, his body's missing really, and most of the rest of it.
That's definitely a problem.
Yeah.
Although he has a permagrin, so.
That's true. He's the lucky guy. You know.
Thank you so much, Daniel, for your time.
Thank you, Matt.